when it comes to the management of PCOS, at AyurVAID, we take a different approach. We don't merely treat the symptoms or the presentations that PCOS gives. Here we do a root cause analysis of the patient, where what is the cause for the disease, where has it led to the symptoms. So basically this happens with the protocol driven understanding, because lifestyle is PCOS is a lifestyle disorder. So correction of the lifestyle becomes our priority. Correction of the diet is a priority, and a personalized care. It is not one size fits all. What we do is sit with the patient to understand different levels of symptoms that the patient has, different levels of presentation, right from the physical and the mental symptoms that the patient on a daily basis suffer from. So each patient is given a specialized understanding of their condition, and based on this root cause analysis, a clear cut protocol is drafted, which is again custom made for each patient. The management starts right from the lifestyle changes, the diet changes, then coming to the panchakarma treatment. There might be oral medication and also hand holding in terms of emotional well-being of the patient, and also complemented with yoga. So all these are the different modalities that we use in the management of PCOS patients. But if you ask me, does all the patient go through all this treatment? No, that is not how it happens. Based on what is the disease progression, based on what is the type of the body of that patient, based on what is the correction that we need to do, and what is the outcome we are looking at, and the different stages of the disease progression, a clear protocol is planned, which might include only diet and lifestyle changes, or might include oral medication, or might include panchakarma treatment and yoga, and also some amount of hand holding for the emotional well-being. So this is the whole understanding of the treatment protocol that we use for management of PCOS. Now, what are the treatment, when I say panchakarma, what are the treatments that can be possibly done for a patient? One is there would be a medicated ghee that we will internally give to the patient. So what this does is helps in clearing the metabolism, which is one of the major factors affected with PCOS. Though there might not be symptoms or very mere symptoms where the patient overlooks at it. To be mentioning that it might be only bloatedness. I've heard most of my patients coming and telling me that when I ask them, do you have bloated? Yeah, it's there, but it's okay. That's not the concern. But that is an indication of the metabolic changes that has undergone in the body, and that is one of the priority to be treated. So when we plan our treatment, all these areas are kept in mind. So we start with ghee, internal intake of medicated ghee, which helps in metabolic correction and the hormonal correction, and then followed by a detox therapy called as Vamana or Virechana. So when I say Vamana, it might be a vomiting session, or when I say Virechana, it can be a purgative session. This does a total detox of the body and brings in the metabolic changes that we are looking at. So, and then the other treatment can be a rectal enema. So based on the requirement, not all patients undergo this, but based on the requirement, the patient can be put through a 8 days of enema therapy with different medication required for the correction of what we are looking at. If the patient is focused more on the fertility part of it, then there might be a specialized gynec treatment in Ayurveda known as Uttarabasti that might be adopted, where a medicated substance is introduced into the uterus, which helps in bringing in the quality of the ovum or even inducing ovulation by itself, which is a challenge in PCOS. That might be used to induce ovulation, to bring in the quality of the inner lining of the uterus, which helps in implantation of the pregnancy and then continuation of the pregnancy. So this would be one of the important treatment that might be planned when infertility is a concern. Then coming to the emotional stability, because most of my patients, I hear them, they are now unable to balance their emotional levels. There is levels of feeling depressed, and then they are excited about something, and there is a phase of binge eating, and then the cycle repeats. So we do handhold our patients even in this states of emotional disturbance, helping them through yoga, meditation, and pranayama techniques. So there are multiple levels of help that we provide to the patient in managing the PCOS, and not merely treating the symptoms, maybe menstrual irregularity or infertility. So a whole person approach is what we adopt, right from doing a root cause analysis and the patient safety as a priority that we look at from the time we start analyzing the disease and the patient till the outcome that we are looking at.